Hello and welcome back to my channel, everybody. My name is yourdoulagrace. I'm a birth and postpartum doula, and today is part 2 of my series, How to Empower Your Induction Cervidil Edition. So we are going to be talking about what many new parents are wondering when planning an induction, because Cervidil is the most common used form of induction out there. We are going to cover the benefits, risks, alternative, intuition, nothing method, as I've done in my previous videos, and we're going to talk about what to expect, how to cope with labor, and just to prepare you and help you feel empowered going into this journey. If you're new here, my name is Grace. I am a birth and postpartum doula, a boy mom to a toddler named Rhodes, and I create videos dedicated to motherhood, birth work, doula life, and everything in between. I just rebranded my Instagram, so you can check that out after this video. I will link it down below, but let's dive right in, because if you're watching this today, it usually means that you are planning a Cervidil induction, or you're just researching, which A+ to you. Love that. Learn as much as you can. You are getting induced, and they have recommended Cervidil. What Cervidil is, it is a tampon-like medication inserted into the vaginal canal that sits at the base of your cervix underneath your baby's head. And the goal of Cervidil is kind of to irritate and get the party started. It is going to compress your cervix, help it efface, get nice and thin, as well as dilate, so open the portal that your baby is going to come out of. I fully recommend having a doula if you are going into an induction for that extra support. They will teach you about it. They will be there to answer all your questions throughout in the moment, and they're just that extra set of hands to help you. So first, let's talk the benefits of Cervidil. We are having a baby. We are utilizing it to efface the cervix, help the baby come down, get to a lower station in the pelvis. You can also go home after getting Cervidil, so it is a medication that can be inserted multiple times over multiple days. Do not go in there and expect to just have your baby right away. That may be the cases for some, but it's usually not. Prepare for a little bit of a journey if you are planning on getting Cervidil, because usually you may end up getting a Foley bulb or using Pitocin still in your induction journey. So really the goal of Cervidil is to ripen that cervix. Let's get her out of the way. Let's get this party going. And the contractions that come from Cervidil can kind of be chaotic. I find that they can really hyperstimulate a uterus, get the party going, really intense, 2 minutes apart, lasting a minute long, and you're 1 centimeter dilated. The math doesn't add up, but that's the goal of it. It's going to irritate the cervix. To get it going, your body needs to start producing oxytocin. So it's going to start with a plethora of oxytocin first, and then over time things will level out. It also is a controlled induction. So with going to Pitocin straight off the bat, there can be a lot of risks associated with that. When giving Cervidil, we're respecting your body and that baby's timeline a little bit more by giving them 24 hours to sit with the medication if labor doesn't progress. It can make the contractions more manageable. It can allow for your body to actually start having labor contractions on its own and continue labor without any augmentation. And it can minimize the need for Pitocin. If we jump straight to Pitocin every time, there would be way more moms having cesareans out there because the body may not be ready. The baby may still be high up. So Cervidil allows the process to be gradual. It allows your baby to get lower in the pelvis, and you can labor at home, which can be absolutely beneficial to help progress your labor. So some risks that we can see with Cervidil, the first one is going to be mother and baby distress, and that can be fetal distress, meaning you need an urgent cesarean. Maybe baby has an IUGR, maybe they are struggling, maybe they are malpositioned. This is going to mean getting a spinal or epidural very quickly and then going for emergency surgery. Very big deal. Always a risk factor when we are inducing with labor. We do not want to induce for any, non-valid reason, just to induce per se, because that's where things can go wrong. So looking for valid reasons for induction, take your time to think through them, research as much as you can, have that doula weigh your options, because these risks are valid. Hyperstimulation, The next one, meaning that uterus is just like, yep, I'm ready, but now I'm over ready and I'm just going to contract. So those big contractions straight off the bat with minimal progression, early epidural, long pushing, possible forceps, vacuum, cesarean still. It's kind of a pattern if you notice it. They all carry these risk factors to them, which is why I super encourage you to research if induction is right for you. And then allergic reactions. Allergic reactions is actually a big thing that happens for a lot of women because we're inserting something into the most sensitive area in your body. That cervix can react to anything when you're super pregnant because there's so much blood flow in the area. It is that chemical as well, so it's going to stimulate the cervix, and in return, the vagina and the vaginal canals can swell. You might get itchy, you might get irritated down there. It's not the vibe. So if this happens to you, go back to your care practitioners, rinse out the area. Do not put yourself through that. You obviously have to go through the contractions to get a baby, but there's the difference between contractions and allergic reactions, and you do not want to have an allergic reaction when you are also having a baby. Now, let's explore some alternatives to Cervidil because informed choice is the most empowering choice. The first one is going to be misoprostol. This can be a medication that's given orally to help stimulate labor. There's also natural methods, so midwifery brew, castor oil. Again, do talk to your care practitioners before taking any of these medications, team. But there are a ton of natural methods out there that you can try. How you got the baby in there is a great way to get the baby out of there. A membrane strip is another option. So that is when they go inside the vaginal canal into your cervix and they separate and stretch out the tissues that are below your baby's head. This can allow for baby to sit lower, put more pressure on that cervix, and get labor going as well. Another option is going to the Foley bulb if you are already partially dilated or effaced. This can get things going a little bit quicker, but it also can mean possibly having your membranes ruptured, which is a risk of the Foley. And we're going to talk about the Foley. Don't you worry about that. There is a whole video coming about the Foley bulb, but it just can mean that we have a baby faster. Are you ready for that? Or does your cervix tell us that we need to give it a little bit more time before we use those alternative methods? Patience and monitoring. I personally do not believe in the Arrive trial as a good choice because if we interrupt birth and labor, we are going to interrupt motherhood and how it happens. So being heavily pregnant, 42 weeks, 41 and 5 even, because statistically most first-time moms do have their baby by 41 weeks and 3 days. So you got this. Keep going. It's your baby's lungs and your baby's brain that signal going into labor. Those are things we want to respect. Maybe you have an IUGR. Maybe your baby is measuring quite large. But again, I want you to read the evidence-based birth document and website about this because it's something to consider where sometimes it's right, but sometimes it's wrong. And then give your body that patience and time. Get the monitoring done. Make the choice if this is right for you, and then get the Cervidil. Go home, labor it out. Let's talk about coping mechanisms. So you can't have a bath. You can, but it will dilute the medication, which defeats the purpose. But you can use the shower. You can sit on the toilet. You can use a peanut ball, a TENS machine, hip squeezes, a massage gun, heat pack, different position booklets like the Miles circuit or the spinning babies ones, breathing techniques, change positions often as your little heart desires, but I like to say every 30 minutes or so, unless you are sleeping and resting well. And visual, support. Have your partner be there with you, like, we got this, babe. This is early stages. Let your body do this, that little extra bit of hype that you deserve when going through an induction. So once the Cervidil kicks in and really is doing their thing, your care practitioner is going to tell you when to come back to the hospital. Usually you're going to follow the 411 or when things progress and you're ready to go back to the hospital. But sometimes things don't happen with Cervidil. So you have to get it another time, and you have to get the Foley bulb, and you have to get Pitocin. It is really a gradual, slow and steady, trust the process kind of thing. It takes its time to build up, very gradual. So again, trust your body. Trust the timeline. Cervidil is doing work. Even if it's not giving you contractions, it's probably still thinning out that cervix and helping that baby come down. So it's a great option to utilize. You can't have Cervidil though if you are a VBAC, so a TOLAC, you are having a vaginal birth after a cesarean delivery, because it increases your chance of uterine rupture. So little fun fact there for you. Just be prepared for that possibility of added interventions or labor augmentations down the line, because sometimes they are needed. Cervidil might not do the job, so we have to call in her cousin, prostaglandin gel, or her auntie, the Foley bulb, and then their big mama, Pitocin, to help us have a baby. A doula is going to be able to help you through all of this, that emotional support, so you know what to expect. You have somebody there to tell you when to go to the hospital, help your partner, tell them what to do, and then support you in the real life moment when things are going down. They're also going to give you tips and tricks like eat celery when you take Cervidil. Don't ask me why. A midwife told me that once, and it's actually worked quite a few times. So go eat some celery once you get your Cervidil inserted, and then go live your life. Go rest. Do not go to Costco, please. You need to do smart rest. And then once things progress, call your doula and they'll coach you through. I love Cervidil for allowing the baby and the body to just get into a good rhythm. A doula can also help you advocate if you don't want other things added to your labor, or if your care goals are going to change, they can help walk you through that process. As we wrap up, remember that every birth journey is unique. It requires creativity, it requires support and a team. You're not going to go through this alone, and Cervidil is a great option to help you get into your labor groove. Like any medication and going into any induction, there are benefits and risks that you do want to consider and remember, but doing things like this and childbirth education, having a doula, is going to benefit you most. If you found this video helpful, don't forget to give it a thumbs up, subscribe to my channel. I post new videos on Mondays. Comment down below any questions that you have. I am here to support you. You can catch me over on Instagram as well as yourdoulagrace, and I will catch you in the next one.